Coming up on Quantum, the stellar search for signs of the next ice age, a new tool to track down rogue cancer cells,
this woman, we'll call her Anne, has just been diagnosed with breast cancer. She's facing surgery to remove the tumour and a large section of breast tissue. Until recently, surgeons would then remove most of the lymph nodes from under Anne's arm, just to be certain no cancer remained. This lymph surgery can itself result in permanent physical disability long after the operation.
People get restriction of shoulder movement, numbness in the inner side of their arm, lymphedema, swollen arms, which can come on any time up to 5 or 10 years after surgery.
Now, instead of removing 10 or 20 lymph nodes just in case, a new technique is helping surgeons detect the single lymph node most likely to be affected by the cancer, the so-called Sentinel node. The lymph system is the body's garbage disposal service, carrying invaders such as bacteria to the lymph nodes where immune cells destroy them. But diseases like breast cancer can spread by hitching a ride in the lymph fluid. The immune cells in the lymph nodes can't recognise stray cancer cells. The cancer is free to progress from one node to the next. In breast cancer, it's essential that affected lymph nodes are removed to stop the cancer spreading even further. To detect suspect nodes, Professor Roger Uren and his colleagues developed a technique called lymphoscintography.
The node in the axilla.
They inject a radioactive solution which enables them to see the lymph channels draining away from Anne's tumour. This shows up the Sentinel node, the node most likely to contain cancer cells.
What you see here, this is the injection site, and you can see a little line passing up to this black spot here. That is a sentinel node in the right armpit. So we end up seeing the actual lymph vessels that leave the area, and we follow those vessels to the first lymph node that they meet.
Images like these provide a rough guide, but actually finding the sentinel node during surgery, among dozens in Anne's armpit, is a far more difficult task. To help solve this problem, Dr. Carl Munoz-Ferrada from the Gammasonics Institute in Sydney developed a miniaturised version of Professor Uren's machine. It's called a Gammaprobe. Professor David Gillette, one of Australia's top breast cancer surgeons, was the first to try out the Gammaprobe.
Just putting a sterile glove over the probe. I'm just using the counter now to double check where that tumour is.
Anne's cancerous breast lump is relatively easy to remove, but the sentinel node is more difficult to find.
We can see here in this upper part of the wound is where the higher counts are.
The Gammaprobe hones in on the radioactive solution injected earlier. It should be concentrated in the sentinel node.
If we shift it by half a centimetre, we lose that radioactive count. It's right in this spot here.
The node is now safely removed, but without the Gammaprobe, it may not have been found.
So we can give that to the pathologist and she can tell us if there is any tumour in that gland.
The pathologist gives Anne the all clear. The operation is completed without unnecessarily removing any healthy tissue.
This lady's prognosis for that breast cancer is excellent. I can't imagine that we would operate on patients with breast cancer these days without the Gammaprobe and without using Sentinel node technology.
Extensive trials have shown the technique is 98% reliable. Now, more than 50 Gammaprobes are in use around Australia, and it's being made available to breast surgeons around the world. It has the potential to spare thousands more women from the side effects of major breast surgery.